right now, as you sit there, tiny shifts are happening in your blood. No pain, no symptoms. They started years ago after 60, but left unchecked, they can be linked with heart strain, foggy thinking, brittle bones, low energy, and early memory slips. By the end of this, you will know the exact 5 blood tests many routine checkups miss, and what to ask your doctor for today. Let me be perfectly clear about something. Most of us grew up thinking a normal blood test means you are good to go. That feels logical. Your doctor says the results look fine, so you relax. But here is the part many people never hear clearly. Standard blood panels often check the basics. They can miss deeper markers that help show risk years before a bigger problem shows up. Think of it like a car dashboard. The usual lights may tell you the gas is okay and the oil is okay, but they do not always show the slow wear inside the engine. And that gap between what most people believe and what the evidence shows is exactly what this video is about. After enough years in medicine, you start seeing the same story told by different people. Same age, similar habits, similar struggles. A senior comes in feeling off, tired, stiff, forgetful. The standard blood work looks clean, but when we look deeper, patterns begin to show. That is why today I want to walk you through 5 things, simple and specific, that matter more than most people realize. Number 1. This one comes up more than almost anything else in conversations with patients over 60. Hemoglobin A1c. That is the blood test that shows your average blood sugar over about 3 months. A fasting glucose test is like one snapshot. A1c is more like a short movie. It tells a fuller story. Blood sugar is fuel for your body. But when it runs high too often, it can quietly stress the eyes, kidneys, nerves, and blood vessels. Right now, inside your body, that stress may be happening without you feeling it. Research from the American Diabetes Association shows that about 96 million American adults have prediabetes, and many do not know it. Evidence from large studies suggests that higher A1c levels in older adults are linked with more heart and brain problems over time. A1c below 5.7 is generally the normal range. If yours is 5.7 to 6.4, that is the pre-diabetes range, and it is worth discussing with your doctor. This is something worth discussing with your own doctor, especially if you have fatigue, thirst, or blurry vision. And number 2 is the test that helps make this one make more sense over time. Number 225 hydroxy vitamin D. That is the blood test for vitamin D levels. Vitamin D acts more like a hormone than a simple vitamin. It helps with bones, muscle function, immune balance, and more. After 60, your skin makes less vitamin D from sunlight, and many people spend more time indoors. That is one reason low vitamin D is so common. The National Institutes of Health reports that low vitamin D is common in US adults, and the risk tends to rise with age. Research has linked low vitamin D with weaker bones and a higher risk of falls and fractures in older adults. Many labs call a level above 20 normal, but some expert groups suggest older adults may do better at higher levels. Think of vitamin D like the helper signal that keeps the body's building crew on task. Without enough of it, the work slows down. This is something worth discussing with your own doctor, especially if you feel weak, achy, or tired more than usual. And number 3 is the one that often surprises people. Number 3. High sensitivity CRP. That stands for high sensitivity C-reactive protein. CRP is a marker of inflammation. Inflammation is your body's alarm system. A little is useful. Too much, for too long, can wear the body down. This is the kind of quiet fire that can smolder for years. This is the counterintuitive one. Many people think inflammation only matters when something hurts or swells, but low-level inflammation can be quiet. It can be there even when you feel mostly okay. Research has shown that hsCRP can help identify higher heart risk in some people, and higher levels have also been linked with frailty and other age-related problems. Alone, a number is generally better. Many doctors use it as one more piece of the puzzle, not the whole answer. Think of it like looking for smoke before you see flames. You want to know about it early, while the fire is still small enough to address. This is something worth discussing with your own doctor, especially if you have heart disease, diabetes, or a strong family history. And number 4 is the one many people mistake for normal aging. Number 4, TSH. That stands for thyroid stimulating hormone. Your thyroid is a small gland in your neck, but it has a big job. It helps control energy, temperature, mood, digestion, and heart rhythm. When that thyroid slows down, everything can feel slower too. That can look like fatigue, constipation, dry skin, weight gain, brain fog, or just not feeling like yourself. The tricky part is that these symptoms are easy to blame on age. Research and expert guidance show thyroid problems become more common with age, and they are sometimes missed because the symptoms are so vague. A lot of labs use a fairly wide normal range, but what is normal on paper is not always the same as what feels good in real life. Think of your thyroid like the thermostat in your house. If it runs too low, the whole place can feel cold and slow. This is something worth discussing with your own doctor, especially if you feel tired all the time or cold when others are comfortable. And number 5 is the one many people overlook, even though it matters for the brain. Number 5, homocysteine. Homocysteine is an amino acid that can build up in the blood when the body does not have enough of certain B vitamins, especially B6, B12, and folate. Think of it like a waste product that should be kept moving out of the system. When it builds up, it can be a sign that something needs attention. Research from the Framingham study and other studies has linked higher homocysteine levels with a higher risk of memory problems and blood vessel damage over time. Some research also suggests that lowering homocysteine with the right B vitamins may support brain health in certain people. This is not a magic fix, it is a clue that can help your doctor look deeper and decide what else should be checked. Think of homocysteine like rust in the plumbing. You do not want to ignore rust just because the water still runs today. This is something worth discussing with your own doctor, especially if memory changes or balance problems are on your mind. Let me give you something concrete, not vague advice. A real simple plan, the kind I walk through with patients before they leave my office. Write down these 5 test names before your next appointment. Hemoglobin A1c 25-hydroxyvitamin D, high sensitivity CRP TSH, homocysteine. Bring the list with you. Then say, can we talk about whether these tests make sense for me? If cost is a concern, ask about cash pricing through common lab services like Quest or LabCorp. Sometimes the out-of-pocket price is not as high as people expect. Morning is a good time to review your lab results and write them down in one place. Keep a small notebook or phone note with your numbers so you can track them over time. If you are busy, the minimum effective step is simple. Walk for 10 minutes after a meal. That one habit can support blood sugar and circulation. For food, keep it practical. Eggs, leafy greens, beans, yogurt, fish, and fortified foods can help support several of these areas without fancy supplements or expensive products. That is the whole plan. No expensive products. No complicated routines, just 5 small decisions, starting today. Before I let you go, I want to say something directly. Everything I have shared today is based on current published research and patterns I have observed over many years of working with patients. It is education information. It is not a diagnosis. It is not a prescription. It is not a substitute for your personal medical care. You are a unique person with a unique history and unique needs. Your own doctor, the one who knows your chart, is always the right first call for anything specific to you. Please use this as a starting point for better conversations with your doctor, not as a replacement for those conversations. I've seen what happens when people ignore the small things long enough for them to become big things. That is not a place I want you to be, which is exactly why I made these videos. You can tell me this, and I really do read the comments. Which of these 5 do you already get, and which one are you going to ask for this week? If you are over 60 and you are taking your health seriously, type testing now below. I want to see how many of us are here. If these gave you something real today, something you can actually use, hit like. Not for the algorithm, for the next person who needs to find this video. Your next video is already waiting. It is about what happens inside your arteries every night after 60. Something with no obvious symptoms that many people only discover after something serious has already happened. It is one of the most important videos I have made. Watch it next.